My name is Nicholas DeFauw, and I'm a primary care sports medicine provider here at Goshen Orthopedics and Sports Medicine. My previous education includes undergrad at Michigan State University, where I was on the swim team, became captain, and then I stayed there and ended up going to the Osteopathic School of Medicine at Michigan State University, which then led me to do my residency in the Metro Detroit area. After that, I moved down to Texas to do my sports medicine fellowship in what actually was the largest sports medicine fellowship in the country. And then they hired me on to become one of the team doctors with Texas Christian University and their fellowship. What enticed me down here was actually the opportunity. The way that the clinic was set up and the way that we also had the same goals and aspirations for how we viewed treating the community. They had actually wanted me to take some time to go do some training room visits at the local high schools to volunteer that time and foster that good relationship with the student athletes, the coaches, and the whole community itself. Even though I'm a sports medicine provider and physician, I don't just take care of student athletes and sports-related injuries. I take care of all sorts of musculoskeletal ailments that may occur from infant all the way to the older population in the 80s and 90s, while also with a focus on the minimally invasive ultrasound-guided or minimally invasive procedures that we can do in the office to help provide relief for these patients. Things such as the percutaneous tenotomy through the 10X system, where we can help treat some of the fibrotic tendon tissues, such as what you see with tennis elbow or lateral epicondylitis. Those type of things are stuff that I like to be able to offer to help give another avenue of treatment for patients rather than physical therapy, NSAIDs, and surgery. I am actually a very good option for patients that may have some pain, are nervous about surgery, or have any other concerns, or even if they just want to become more active and they're having some pain that's holding them back. If a provider is referring a patient to me, it's really not just me that's seeing them, it's the entire team. No one in our office is afraid to really discuss care with each other so that we make sure that we give the most quality care we can for all the patients and do what we all believe is the best choice and the best thing moving forward for those patients. So a lot of times I can be the initial care that the patient sees within our office. I can help coordinate the care from there if it is needed. I will try to take care of obviously all the non-operative stuff if need be, and if I do feel that this needs to be seen by a surgeon, I will send it over to the surgeon. We do try to take a look at the patient's chart and everything beforehand so that if it is more appropriate for them to see the surgeon right off the bat, I don't just waste that visit with me. I get them over to see the surgeon and try to flip it over there and try to manage that as early as I can. But a lot of times there's some steps that we like to try to do beforehand. For example, if someone has some sort of knee injury that I think might have an ACL or a meniscus or something that needs to be done, I can order the MRI and then set them up with my partners to be seen. I was a referring provider in my training, so I do understand the ownership you have of your patients and how you really want to make sure that they get the most quality care, because that reflects upon you as their primary care provider.